She was a nurse practitioner. She had checked her own skin twice. She was certain. She was wrong. Esther Quinn was 46 years old and had been a primary care nurse practitioner for 18 years. She had taught skin cancer screening at 3 different community clinics. She had a wall in her hallway with framed continuing education certificates. She had been the one in 2 separate cases who had spotted melanoma on patients other clinicians had missed. She knew what she was looking at when she looked at her own arm. Her arm, specifically the inside of her left forearm just below the elbow, had a mole. The mole had been there since college, round, even brown, the size of a pencil eraser. She had checked it in March at her annual derm visit. The dermatologist had checked it too. They had both said the same thing. Stable? No change. See you next year. That was March. By the first week of August, her golden retriever Lambert had started licking the mole. Lambert was 9 years old and had been with Esther since he was a puppy. He was the kind of golden who had learned, over years, exactly which behaviors got him gently corrected and which behaviors got him praised. And he was generally a dog of pleasant calibration. He did not lick faces. He did not lick hands. He did not lick anything other than his bowl and the occasional dropped piece of cheese. On the first Wednesday in August, while Esther was reading on the couch, Lambert had walked across the rug, sat down beside her, and pressed his tongue against the inside of her left forearm. Once. Slow. Deliberate. He had pulled back, looked at her face, and pressed his tongue against the same spot again. She had pushed him gently. He had stopped. He had walked to his bed. 2 days later, he did it again. Same spot. 2 slow, deliberate licks. Same considered pullback, and look at her face. She told her husband about it that night. Her husband, who was a software architect and not a medical person, made a joke about Lambert having a salt fixation. Esther laughed. She also pulled up her sleeve in the bathroom that night and looked at the mole under the vanity light. It looked the same. She was certain it looked the same. She had checked it in March. Lambert kept doing it. Every 2 or 3 days. The same spot, the same considered approach, the same look at her face after. Esther began to count. By the 4th week, she had counted 11 separate occasions. She mentioned it to her own doctor at her annual physical in early September. She mentioned it casually, in the same tone she might mention her gym attendance. The doctor, a woman who had been a colleague for 10 years, did not laugh. The doctor said, "Show me." Esther rolled up her sleeve. The doctor looked at the mole. She used her phone flashlight. She used her dermatoscope. She said, "When did your derm last see this?" Esther said, "March." The doctor said, "I'm going to refer you back today." Esther said, "It hasn't changed." The doctor said, "It has. You're looking at it from the angle you've always looked at it. From this side, the border at the 7 o'clock position is irregular." Esther tilted her arm. She saw it. The biopsy was done 11 days later. The pathology came back the following Tuesday. Melanoma in situ. Caught at the stage at which a wide local excision is curative. The dermatologist who did the excision was a man Esther had known for 15 years. He said, as he was finishing, that this lesion would almost certainly not have shown observable change for another 4 to 6 months. He said, by then it would not have been in situ. He said, someone caught this absurdly early. He asked, who flagged it? Esther said, my dog. He looked up. He said, that's the 2nd time this year I've heard that. He told her that dogs detect the volatile organic compounds melanocytes release as they begin their pre-malignant change, a chemical signature so faint no human nose can register it, and so specific that trained detection dogs at one academic medical center identify melanoma samples with greater accuracy than the average dermatologist using a dermatoscope. He said, he kept licking the same spot. He did not finish. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Esther's oncologist, when she went in for her post-excision follow-up the following month, asked the same question. Esther told her, the oncologist, a woman roughly Esther's age who had spent her career delivering harder news than she had today, looked down at the chart for a long time. When she looked up, her eyes were wet. She said, I'm not supposed to say this. She said, I see 10 of these a year that came too late. She said, I'm so glad your dog wouldn't stop. She did not finish. Has your dog ever licked, sniffed, or pawed at a specific part of your body and refused to stop? And later you learned why. Tell us. We read every one. Lambert was 11 now. He had not licked the spot since the excision had healed. He had not licked anywhere else either. He had returned to his calibrated quiet life on the rug by the couch. If stories like this matter to you, subscribe so you never miss the next one. Esther kept a photograph on her hallway wall now, next to the continuing education certificates. It was a picture of Lambert taken in October, looking up from the rug. She had stopped explaining the photograph to visitors. The ones who needed to ask, asked. The ones who knew,